Hello back, everyone. We are starting the next session during the Second Global Oncothon, and it's my pleasure to introduce you Dr. Tsetsegsaikhan Batmunkh, who is the CEO and founder of National Cancer Council of Mongolia. Thank you so much, Dr. Batmunkh, for joining us, and I will be happy to hear the experience of pediatric oncology in Mongolia, what challenges you face, what solutions you have for that. And also, I know that the SIOP Asia is coming to Mongolia. How the preparations are going?
Thank you so much, Shusham. So it's great pleasure to join you today all. And it's my great honor to be part of the Second Global Oncothon, a one day, one mission when we are together raising awareness and mobilize for children with cancer around worldwide. And I sincerely thank the OncoDaily team for this invitation and providing an important platform to create a meaningful impact. And International Childhood Cancer Day is a special day when we all come together to raise awareness about childhood cancer, support families, and advocate for better care. This day plays a vital role in uniting global experts, healthcare professionals, and patient communities to drive actions for childhood cancer care. However, we must accept every day that the challenges faced by children with cancer will rise significantly, and in many low and middle income countries, childhood cancer survival rates remain unacceptably low due to limited access to medicines, the shortage of trained specialists, financial issues, and inadequate healthcare infrastructure. And every child, regardless of where they are born, deserves the same chance of survival. In case of Mongolia, children are diagnosed with cancer each year, and while our survival rates have not yet reached those of high-income countries, we have made significant progress in recent years, and I'm so grateful for our collaboration with World Health Organization and St. Jude Children's Research Hospital initiative, which has made Mongolia as a focus country within the Global Childhood Cancer Initiative and also global platform to access childhood cancer medicines. And through this partnership, childhood cancer has been recognized as a national health priority, leading to policy changes, development of detailed action plan, and improvement in clinical guidelines of pediatric cancer. As patients' lack of information about childhood cancer diagnosis, we developed with St. Jude's Research Hospital together team 6 fact sheets on 6 index cancers and 20 medicines and launched them yesterday. And also yesterday, we received our first batch of essential childhood cancer medicines through this partnership with Ministry of Health, WHO, and UNICEF, which is a major step forward for our young patients. And I strongly believe that expanding these initiatives to other countries will outcomes, saving the lives of many children. However, much work still remains. And I would like to echo Dr. Asam's comment on the importance of clinical trials in low and middle income countries. Countries with limited resources, workforce, and capacity must work together to strengthen our ability to conduct clinical trials. And additionally, I would like to, we need to who require transplantation or specializable in countries with limited resources, and collaboration and cross-border patient referral systems are crucial to ensuring that every child receives the best possible care regardless of the country of the born. And I'm also pleased that Shushan mentioned to announce that Mongolia will host the SIOP Asia 2026 conference. And we warmly welcome and invite the Global Childhood Cancer to join us next year in Mongolia for this important. And in conclusion, I would like to say that the fight against childhood cancer requires global solidarity and collaboration. Thank my full and encourage everyone to. And as part of this movement started by Princess Dina Miret, I'm inviting also 3 of my friends to donate $10 each for SIOP. And I would challenge them to invite 3 other friends to do the same. And through this collective effort, I think we can support the broader childhood cancer community and make a meaningful impact. And I would like to wish great success to the Second Global Oncothon. And together we can make change in the future of many children with cancer. So thank you so much.
Thank you so much, Dr. Batmunkh. Thank you for creating the chain for donation. It's very important that also we can encourage our friends, environment. So thank you very much. It's very, we really value that. And you spoke about the global platform of essential medicines. It's a wonderful program. And I guess you are one of the pilot countries that they started to provide essential medications. And you also highlighted the importance of clinical trials. Now, I want to ask you specifically for Mongolia, what are the challenges that you are not able to start clinical trials? For instance, investigator-initiated trials, some trials that are not requiring a lot of funding. So what are the obstacles that don't allow you to start a trial?
The first challenge will be, of course, the policy challenges. There are not many regulations around how to conduct proper clinical trials, especially among children. And that's why this one will be the first challenge. And the second challenge is, I think that the parents or community perspective in terms of clinical trials, many patients sometimes are against clinical trials and thinking that it's kind of a trial on their children. So overcoming this misunderstanding about clinical trials might be the second challenge for our country.
That's very interesting to hear. And do you have any solutions, especially for the second one? Any raising awareness campaigns for patients and families?
I think we need to have a campaign or education campaign, especially among patients, families, and parents, about the importance of involving in clinical trials. Because one country can't do much alone, and together, jointly with other countries with a lot of research background and experience, I think we can achieve a lot in the treatment
Yeah, I
of children.
completely agree. And in my dream world where pediatric oncology treatment is done entirely, I imagine that we shouldn't limit us in geographical barriers, and we need to collaborate everyone. It doesn't matter high income country, low middle income country. So that is the key to reach the success. Thank you so much, Dr. Batmunkh, for sharing your experience. It's really interesting and productive. And I would like to remind everyone that we are here today for the second Global Oncothon, which is a 24 hours telethon aiming to raise awareness and funds for pediatric cancer research. And the funds are going to the International Society of Pediatric Oncology, and it will be distributed as research grants, as a career development awards, young investigator awards, park grants. So this is a wonderful opportunity for all the practicing pediatric oncologists and also children, because if we improve the survival, if we implement improved research methods, then we will help children with cancer. So thanks a lot, and let's dive into the next session.